The United Nations Children Fund, UNICEF, has donated essential medical supplies to the Niger state government to help contain the spread of cholera outbreak in the state. The presentation of the item was done by the Water, Sanitation and Hygiene Specialist, UNICEF Kaduna Field Officer Teresa Palmer at the Isolation Center of the Old Wing of late Senator Idris Ibrahim Kuta Primary Healthcare Center, Old Airport Road, Mina. The report.
The UNICEF Water, Sanitation and Hygiene Specialist at the Kaduna Field Office, Teresa Palmer, who led the theme, said the items donated are to support the state government's effort to mitigate the spread of the disease as the state continues to record new cholera cases. She disclosed that the essential medical supplies include water purification tablets, cholera treatment kits, drugs, among others.
I'm here to make a presentation of cholera supplies to Niger State government as part of UNICEF contribution in breaking the transmission of cholera in the state. We have community kits, which is drugs in 3 cartons. We have periphery kits, also 3 cartons. We have basic cycling, 10 cartons. We have cholera kits, 350 cartons. We have glucose, 5% of 500 mils, 10 cartons. We have water purification tablets, 4 cartons. And then we are also expecting the arrival of chlorine, 10 drums. Yeah, we've made previous supply to the state, and now we have brought 7 different items as we still get reports of reported cases. Even here in this facility, right now we have 7 people that are still on admission. 4 of the cases have been confirmed positive, while the others are still waiting verification from laboratory analysis. So it means the incidence of cholera is still in the state. So we have come to support with drugs for treatment of the patients, and then we have basic water and sanitation kits, particularly cholera support kits to help community people provide to get safe water, treat their water, and then they drink water that is free from microorganisms.
She notes that open defecation and consumption of unsafe water are the major causes of cholera and caution the public on the need to promote protective hygiene measures such as hand washing, water sanitation, among other measures.
Well, wherever you hear about reports of cholera, you know that there's excreta on the surface. And that excreta has entered into sources of drinking water or contaminated food. And Niger State has open defecation practice of 46%, which is very, very high. Now, part of this excreta runs into sources of water, and we know that there are people that are still drinking water from unprotected wells. Some are drinking from rivers, and that's why contaminating those sources becomes very easy. And then we still have people that use vegetables that may have been harvested from farms where they use human excreta as fertilizer. That's another dangerous practice. We also have water vendors that they sell water, and nobody cares where the water comes from. Some of that water comes from contaminated sources, and that is part of why we still have cases that have been reported. My call to the public is that if every household in Niger State can have a toilet, cholera will not come.
While receiving the items, the State Deputy Director, Disease Surveillance and Notification, Uriah Mahmudu, revealed that there are new cholera cases being reported, with about 27 patients on admission at various cholera treatment centers across the state.
As of today, we have a total of 27 cases on admission across the state. These 27 cases are from Munya, Shiroro, Boso, Chanchaga, and also Boso. In Boso and Chanchaga, we have one CTC, that is Cholera Treatment Center. And the total number on admission here, as of this morning, is 7. That of Wushishi, we have total number of 8 on admission. And as General Hospital Kuta, we have 10 on admission. And at PSC Kabula, we have 2 on admission.
He appreciated UNICEF for the gesture and assured that the medical supplies would be used judiciously.
When the items comes, we normally after the treatment, as they discharge the patient, we give them the package that they're supposed to go home with, and how they will use it, we make sure we explain to them.
From the Isolation Center, Pamela Duma reporting for NSTV News.